Hello and good day. Welcome to the beginning of the second series of our open online briefings about COVID. We really focus on people-centered approaches to COVID, on local level community action to COVID, and we try to keep as up to date as we possibly can. We're very keen to encourage everybody who wants to join these briefings, and the format will be pretty much the same as we had before. It'll be 30 minutes of an update from myself. Wherever possible, I'll also invite other guests who work on the global response from the World Health Organization to join during that early session. And then we'll have 30 minutes of interactive discussion. I encourage you to send in your comments and questions. What I try to do is also give you a chance to make your comments live so that you can be part of the interactive discussion. I ask you to be as brief as possible, but at the same time, I want to be sure that you have your voice. Just like to make a couple of comments before we get going. First of all, I'd like to thank Chris Shipton, who's a visual scribe who runs Live Illustration UK. You can see Chris Shipton's screen, and Chris has started his live illustration. We're really grateful to Chris and his colleagues for the illustrations that he did of some of the briefings in the first round. These have been put on the website together with the actual recordings of the briefings. And I get messages from people all over the world saying how much they value the excellent illustration that Chris and his team members do. Thank you, Chris. Secondly, I'd like you, if you can, to grab a face mask. If you've got one, I'd like you to put it on. I'll tell you when. Because we are participating in the Wear a Mask campaign. This is a wonderful campaign that's been brought together by Pandemic Action Campaign, by the World Health Organization and others, connected to Wear a Mask Week. And we're right in the middle of Wear a Mask Week. And some of us have already been challenged to wear masks in public. You might have seen that there's a picture of myself and my grandson, Ori, wearing a mask in the supermarket. But what I'd like to do today, if you've got your mask, is to invite you to put it on and then to turn on your video. And I'd like to ask Twee, who you can see, who's wearing her mask, to take a screenshot of all of us here wearing our masks. So we need to make sure that we're looking good. Thank you. Joe's gone to get his mask, so wait for him. I think Chris has gone to get his mask. William's got his mask on. Marianne, you've got a nice blue mask. Gosh, Rebecca, I like your mask. That's great. It's sort of purple and special. Jane, you've got a black mask. I like yours. Joe Nichols, are you on today? Hello, Joe. Oh, gosh. And who's with Joe?
Yeah, it's my daughter, Zara.
I thought it's Zara. Hello, Zara. Nice to see you again.
Hi.
There you are in Nairobi. DJ Forcer. DJ, nice to see you. Thank you for wearing. Puri, you've got a nice mask on. It's lovely. Nice to see you in New Delhi. Florence, thank you. There's a person saying iPhone, but I can't recognize you because I can't. It's one of the things I find it harder to recognize people wearing their masks. I think I'm not going to guess who it is in blue. Paul, thank you for wearing your mask. Shafiqul, if you've got a mask on, if you can turn your video on, that would be great. Thank you, Chris, for putting on your mask. Marianne, that's great, got you. Andre, thank you for putting on your mask. It's nice to see you there. Corinne, thank you. Iman, not sure whether, Amanda, thank you for getting your mask on. That's wonderful. Great. Okay, we're nearly there. Rojanji, you're here. Yeah. Zara is there, and Miles, is that you there in the group? I just want to say how delighted I am to see Miles there. Miles who's recovered after quite a long period of being not well. Great to see you looking fit and well with a good head of hair. Wonderful. Carlos and Veronique, nice to see you both there. Nice masks as well. So let's all, yeah, we're all here. Those of us who, Mary, it's you with the shoulder splint. Oh, I'm sorry you've done something to your left side. I hope it's all right. Looks like a collarbone or something. Anyway, good that you're there. All right, so we're here. And so if everybody could get center frame, that apparently matters. Make sure your mask is visible. Twee, are we okay? Over to you now. If you want to, we'll all smile behind our masks.
It's yeah, we'll say cheese. I won't change how the picture looks, but in 3, 2, 1, cheese.
Cheese, there you are. We're all.
Thank you all.
Thank you, everybody. Okay, we can. Thank you very much. Wonderful. And lastly, is just as we get started, we're very keen to know who's joining. We don't necessarily have to have your name, though we will find it out and, because of the way the thing works. But if you could use the chat function just to tell us where you're joining from. We like to know your age range. Twee, I'll just invite you in a minute to give people clues. Do you want them by quintile or decile or some other technique? But the most important is Twee would like to know how you're feeling today. Oh, here we go. Here's the poll. And Twee, would you like to explain how that's going to be done?
Sure, we've got 3 questions here, just to get us a bit more interactive with each other and recognize where we're all coming from, our age range, because it's always very important to engage with people across different age groups. And we always like to know how we're all feeling. This journey is a long one, and it can be difficult at times, but we find these moments where we come together very useful. And hopefully over time, if we keep doing these polls, we can see how everyone's feeling over time. So I'll give it a few more seconds and then I'll end the poll and I'll be able to share the results.
Just filling mine in. Age range, haha. Can you click more than one of these things on the multiple choice number 3, or is it one only?
In number 3, you can click multiple.
Oh, brilliant.
So about 18 out of 32 have responded. I'll stop it when we hit 2 more, 25. I'll stop it. Great. And you should be able to see the results. Back to you, David.
Thanks very much indeed. I like the fact that this is an instant poll. I think that's great. And I also like the fact, just looking at this, that there's quite a lot of optimism and hopefulness in our group. Thank you for that. I have to say that that's where my own emotions are. Good. Okay, well, thanks again to Twee. And thanks to you all for filling in. Time to greet Shekufe. Nice to see you again. Thank you. And Rebecca, gorgeous to see you again. Really, really nice. Sarah, thank you for joining. Kathleen again. Nabila, Samendra, and Andres as well. if I haven't mentioned you, and just to know that I really very value these moments and the opportunity to connect with everybody. So what I'm going to do is to be, this time, because we've had a bit of a gap, I'm going to be quite formal and report on what I'm seeing. I debated whether to show you the outbreak curve. I decided this time not to, but I will talk about it. Well, over the last few weeks, we've continued to see week-on-week rises in the numbers of new cases of COVID reported to the WHO. But there has been, very interestingly, suggestions of a slight drop in the last week. And I'm wondering what's going on. We're going to have to wait and see whether or not we're beginning to see a slowdown in the rate of increase. What we are seeing, though, if it's dissected, is that in Southeast Asia region, which is the WHO region that includes India, Bangladesh, Nepal, and Indonesia, the numbers of reported cases continues to rise. And this is a reflection of the continuing numbers of new reported COVID cases in India. There's also increasing numbers in Bangladesh, Nepal, and Indonesia. And you've heard me before talking about India, expressing real satisfaction at the speed and intensity of India's response. But I have to also say that because people live in such cramped conditions in many urban environments, not just in India, but also in Bangladesh and Nepal, also because of some really difficult weather challenges in Southeast Asia right now, I'm not surprised to see that the numbers continue to increase in the Southeast Asia region. I hope that the rate of increase will slow and that it will prove possible for India to be able to get on top of the COVID expansion. But right now, it's a really difficult challenge. There's also continuing increasing numbers of cases in many Latin American countries. The United States situation is mixed. Some parts of the United States are beginning to get ahead, but other parts, particularly some of the southern and more western states, are facing continuous difficulty. In Europe, the reduction in the numbers of cases has continued, but there is clear evidence of early spikes of COVID in the European countries that were able to get on top of their outbreaks. And these early spikes at the moment are being contained, but there is widespread concern in Europe that in the next 4 weeks or so, that numbers could go up rapidly again. And the newspapers in Europe are full of anticipation that what's called the second wave is coming. But I want to stress that we will expect to see continued spikes coming, and we may even see occasional resurgence. And this will be the new reality. And what's going to happen is that countries will be able to get on top of these spikes and contain the resurgences as a matter of course, because that is going to be the reality in the interval between now and when a vaccine is hopefully available and everybody is able to be protected. Now, this is important. It means that all European nations and all nations throughout the world, in due course, will need to be able to come to terms with the fact that they will have continuous COVID, but at low levels, and they will be able to get on top of these COVID outbreaks because of being well organized. And that will be the way of life. It should be possible to get on top of COVID outbreaks without having to have nationwide lockdowns. And I'm going to talk more about that today because it's really one of the most important of the 5 key points I want to make. The only other thing on the global landscape is that there has not been a massive increase in numbers of cases in Africa. And it's still unclear as to what's going on, but my current supposition is that the virus is spreading in Africa, particularly in urban areas, but the testing capacity is limited, and that means that the impression that we've got is still an underestimate of the real situation. The situation in East Asia is still pretty good, with China being able to stay on top of its COVID, Singapore struggling a bit with the foreign workers in dormitories, South Korea reasonably on top of their COVID, Philippines, however, facing some major challenges. So a mixed picture, but I do believe that more and more governments and more people realize that this is not a virus which is going to go away, and that we all have to be able to get ahead of it. We get ahead of it through a number of common principles, and in doing that, by getting ahead of the virus, we enable economic and social activity to return. Not as it was before, with a new approach, but at least economic and social activity can restart. So I come to my main points. Point number 1, a lockdown is not a good way of actually getting on top of COVID. A lockdown is potentially very useful because it buys you time by freezing the virus in place. It buys you time by reducing the rate of transmission, but the virus doesn't go away. The only way in which you can get ahead of the virus is by adopting a series of common principles that lead to the comprehensive approach for dealing with COVID. And so this is my second point in my 5-point briefing. The common principles are as follows. People must be fully engaged. They need to continue to practice physical distancing, at least 1 meter and ideally 2 meters, especially in confined locations. They need to use a face covering, and that should be a proper mask. There are some people now recommending that the mask should be a combination of a surgical mask, as is used in the dentist surgery, and then a cloth mask like those that many of us have. I believe that there will be a lot more work on what are the best forms of face covering. Thirdly, everybody must practice hygiene, hand washing, proper cough etiquette, and cleaning of surfaces. And fourthly, people must isolate when they are sick. You must not be coming to work. You must not be doing social stuff if you are feeling sick. This set of personal behaviors has to be at the center of the common principles. We also need to have integrated local level action by all in society, focusing particularly on high-risk settings. There's increasing evidence that women are at particular risk. There's increasing evidence that people from ethnic minorities are at particular risk. There's increasing evidence that people working in factories where they are close together in confined spaces, like meat processing plants, fish processing plants, vegetable processing plants, and the people who live in very confined areas. We have to put priority on these and involve everybody, and it has to be integrated and at local level. The third common principle is the need for well-functioning public health services everywhere to find cases, to interrupt transmission through detection and isolation, through finding contacts and isolating them as well, and through containing and suppressing outbreaks promptly with support for those who are most vulnerable. These public health services are essential. They've got to be everywhere. Without them, economies cannot restart. Another part of the common principles is you've got to keep health services for non-COVID conditions functioning so that those with other diseases can get treatment. We have reports from all over the world of people who have cancers not being able to get treatment. Women who want to access sexual and reproductive health services, to get contraception, to have abortions, or to get other needs, or children needing to have acute care, just not able to do so because health services have been paralyzed because of COVID. We must do everything possible to keep the rest of healthcare functioning. And then to do that, next strategic principle, we must give special attention to healthcare personnel. We've got data from all over the world telling us that the situation for health workers is really serious. High numbers of health workers dying in Bangladesh, in Nigeria, in South Africa, in Latin America, in the US, in Europe. And when the reckoning is done, we will see that there's been an awful lot of health personnel, porters, assistants, cleaners, as well as nurses and doctors. The sixth strategic principle, we must communicate what is happening. We've got to have a clear narrative. If there is confusion in the messaging, people don't know what to do. And there's got to be two-way dialogue. We've said it before, I'm saying it more and more strongly. People need help to make sense of this. In Berlin, in a recent demonstration, tens of thousands of people took to the streets with anger at the fact that they are getting messaging that they don't understand. They're in the midst of a life-changing situation that they cannot comprehend. We have to have two-way communication that helps people make sense of it. And then my seventh point is that we have to be able to assess the performance of services to get ahead of COVID. The testing, is it being done according to strategy? The proportion of tests that are positive, is it more than about 5%? Is it up in the 10 or 15 or 20%, like Joe was telling us from some of the Somalia figures? And then when cases are identified, are they known contacts of people who've already got the disease? Or have they got the disease from unknown sources? And then if people are being asked to isolate, are they getting paid while they're asked to isolate? Or are they having to pay for it themselves? These kinds of indicators of performance are absolutely key, much more important than case numbers. And recently, two colleagues, Y.Y. Teo and Dale Fisher, together with myself, did a little commentary in the Lancet Medical Journal saying that it's much more important to know the performance of COVID responses than simply to be measuring numbers of cases, because that's the way we get on top of things. So I'm now being really explicit everywhere I can, saying there are 7 strategic principles. I've lifted them out of the WHO literature, but I've given them my own language. And firstly, engaging the people fully to do all those things that I mentioned at the beginning: physical distancing, face covering, hygiene and isolating when sick. Secondly, getting integrated local level action by everyone in society with a particular focus on the places and people where risks are highest. Thirdly, well-functioning public health services everywhere. Fourthly, making sure that essential health services can continue to work so that COVID doesn't paralyze them. Fifth, paying special attention to care providers, but all care providers, remembering that most of them are women, a lot of them are very poor paid, many of them are agency staff. Sixth, a clear narrative communicated in a well-articulated and unambiguous and consistent way with two-way dialogue. And then 7, good metrics for assessing performance that focus on people. Now, that is so important. During the last period when I was not doing these briefings, I had the opportunity to be with different members of my family. I did an awful lot of media interviews. And the one thing that I realized was that we're not getting these strategic principles across, and that different governments just have not managed to themselves internalize these issues and to communicate them with their people. So we end up with a confusion about the narrative in people's minds. I told you I've got 5 points. I started by saying the virus is not going away. I then went on with these 7 strategic principles. Let me now just talk a little bit about the disease, my 3rd point. Yes, the disease can kill, and it kills people who've got other medical conditions, it kills people who are older. And then an awful lot of other people who get the disease don't die. But we've got an awful lot of evidence now that between 5 and 10% of people who have symptoms of COVID have the disease for a long time. It's called long tail COVID. We've talked about it in these briefings, but now it's clearly understood. In the UK, the chief medical officer tells me that between 5 and 10% of people with COVID have got long-term sequelae. They either are suffering from continuous fatigue, or they're suffering from breathlessness, or they're suffering from terrible headaches, or they've got other conditions that make them feel unable to work and to relax, or they've got some combination of everything. But we can no longer tell each other that this is a disease that kills a small number of people, perhaps 1 or 2%, and they tend to be older people, and everybody else recovers fine. No. Long tail COVID is a reality. It's affecting thousands of people, tens of thousands of people all over the world, and it's having a major impact on well-being, mental health as well as physical well-being, and it's having a major impact on productivity. Let's keep remembering this. Let's link to it the constant search for good therapies that will help people to have a quick recovery and a full recovery and not force them to go into intensive care. These include oxygen therapy. They include dexamethasone treatment to deal with the immune system. And they include other treatments that will reduce suffering. They do not include hydroxychloroquine or other medicines that have been proposed but not proven. And as we get more information about treatment, we will be the first to tell you. I come to my 4th point. This is an issue that requires everybody. It requires communities, it requires businesses, civil society organizations, universities, youth groups, media organizations. It requires every single element of society working together. It has to be locally focused because that's where the important decisions are made. It has to be alert to and responsive to new outbreaks occurring. It requires rigor and rapidity, and it requires open communication. Let's keep reminding everybody that it's a collective effort. And if leaders are not doing their job, let's the rest of us fill in for them. This is just not a situation where we have to go on waiting for recalcitrant leaders to take the decisions that are necessary. This COVID is here to stay. There are 7 strategic principles that matter. There's a long tail of illness in 5 to 10% of people with symptoms. It requires everybody working on it, and we must all do it. I am working ever harder to contact business leaders, to contact civil society actors, to contact community workers, and just say, don't hold back. Do whatever you can to lead on behalf of your communities, on behalf of your employees, on behalf of all those with whom you work. We have to connect together to deal with this. Don't let's be paralyzed by the failure of major world leaders to take this issue seriously. Let's keep reminding everybody that this is a disease of inequity. Poorer people are suffering the most, and we have to act for everybody's sake. And now to my last point. I'm super hopeful that there will be at least one vaccine found soon that, when given to people, leads to antibodies developing that protect them against the disease. I'm really hopeful that this will happen in the space of the next few months, or at least a year. I'm realistic. I know it could be 2.5 years, but I really wish it could be quicker. And I'm very excited to read that there are a number of vaccine candidates being looked at by the WHO in connection with an initiative that goes under the umbrella of Access to COVID Tools Accelerator, or ACT Accelerator. This is looking at vaccines, it's looking at treatments, it's looking at diagnostics. Our colleague Bruce Aylward is leading this, and he and I have been in conversation. I hope that one of these days Bruce will join us to brief us on this. But in the meantime, let's remember, a vaccine has to be shown to be safe. A vaccine has to be shown to work. A vaccine has to be available so everybody in the world can get it at an affordable cost. It's going to take some time. It's going to require enormous political efforts. Just today, we heard that the president of Russia has declared that there's a vaccine candidate that's available now in Russia that's going to be quickly approved for use and made available to the Russian population. Now, I want to be clear, this looks very promising, but I also want to be clear that this vaccine has not completed the 3 phases of clinical trials that are necessary to get the data that are then taken to national regulators and that are taken to the World Health Organization for the necessary processes to decide whether or not this vaccine can be approved for widespread use. I'm really hopeful that this will be a valuable vaccine. It's coming from a country that already produces the majority of yellow fever vaccine for the world, a country that produced an awful lot of doses of smallpox vaccine when smallpox was eradicated. But work will be needed, and it will take some months, and I can't really truly estimate how many, but I suspect at least 6 months before the phase 3 trials are completed, the data is assembled, and then it starts to go through the various regulatory processes. So there's going to be a lot of work downstream to get to a point where it'll be possible to say to people, to look them in the eye and say, this is a safe vaccine. You can give it to your mother or your father, or offer it to your mother and father. And we got to remember that there's a large community of people who really don't believe in vaccination. And so we have to take that into account. So all I'm wanting to say to you is that there's a lot of excitement about vaccine today. There is work still to be done. Let's acknowledge and greet all reports of vaccine candidates coming, whether they're from Moderna in the US or from AstraZeneca and Oxford University in the UK, or from China, which has got at least one candidate going through phase 3 trials, or from Russia with a candidate going into phase 3 trials, or from other countries. But let's just recognize that the task of doing the necessary tests to make sure they're effective and safe, and then the challenge of getting them produced in sufficient volume and made available to everybody so that there's not a long queue with the poorest at the back of the queue, that's a big task. And I'm so pleased that our friend Bruce is working on this. So that's my briefing. I'd like to just confirm that there were 5 points to it. I do like repeating what I've said when I've said it. I started by saying the virus is not going away. And my opening point was, let's not use lockdown as the primary control measure. My second point was to say there are 7 strategic principles. I won't go through them all again. I will be very happy to put them in my next narrative, which I'm developing at the moment, and you'll get that on the website. Third, I talked about the disease, and I stressed that the long tail COVID is a problem for me. I don't just look at the death rates. I also look at what we call the morbidity or sickness rates. Fourthly, everybody's got to be involved. There's a huge role for businesses. There's a huge role for universities, a huge role for civil society, particularly at local level. And then fifth, I wanted to talk a little bit about the access to COVID tools, the access to COVID tools accelerator and vaccines. And perhaps I should just say, I'm also relentlessly looking for rapid diagnostic tests because I think they would be very important. While I was talking, I noticed 1 or 2 people have joined. I want to give a special shout out to Tom Arnold from Ireland. Tom, it's great to see you. You're quite pensive there, and it's lovely to see your face and to recognize you again. And if when we start the interactive part, if you want to say a word or two, you and anybody else, please come in. I'm just truly grateful that you're here. Wanted to greet Paul Rushton. Thank you for joining. Great that you're here. And just to say hello to Delphine, to Laura, to Kumar, and others who've joined a bit later, to Nikhil. Thank you very much for being here with us. We are using the usual system. Just mention if you want to say anything through the chat. Just want to say that I am here with members of the Forestry team. I'm sitting with Florence and with Catherine, who are very kindly assembling comments. Also, we've got joining us on through the Zoom, John, thank you for being with us. It's lovely that you're here. Tui, who we've already heard from, thank you. Magali, who's usually here, and Sabel, who's usually here, they're both on leave. Joe, I know that Joe Nichols, I know that you're working in Somalia for the United Nations. You're currently in Kenya. I've been reading some quite serious points that have come from Kenya. I'm just going to give you a little update that I had, just that I was looking at and thinking of you while I read it, that the Kenya Nurses Union warns that health services in Kenya have had to decrease because more and more health workers have got COVID. There are 23,202 cases in Kenya, 388 deaths. That's of August the 5th. It's really increasing quite rapidly. And the National Nurses Association and the Kenya National Union of Nurses are both really worried because so many nurses and medics are getting the virus. 5 health facilities in Nairobi closed or about to be closed. And unfortunately, 8 healthcare professionals in Kenya have died. You also said, Joe, in the note that you gave us on the chat, that there was quite a lot of stigma, that COVID is now becoming a label for stigmatizing people, that there are people not keen to get tested. They're really worried that if they then die, they won't be able to have a dignified burial that fits with the local customs, a bit like, Joe, what we had with Ebola. I think we both remember how difficult it was that when people couldn't get their proper death rituals, they got very upset. Joe, do you want to come in and make any comment? And Rojan, I'm going to ask you to come in shortly after that, because you also want to talk about the potential for COVID spread from cadavers, and I'll give you a chance to talk about that. But Joe first. Joe, you have the floor.
Yes, thank you. Yeah, I mean, I think in both Somalia and Kenya, there's definitely evidence that there's stigma. I mean, in Somalia, people seem very reluctant to go for tests, and that's partly because of lack of trust also in health services, and I think what is sometimes termed poor health-seeking behaviour. And so much so that there's been no reports of any cases or any deaths since the 5th of August, and actually a 0 report for today, which seems extremely unlikely. But people are very reluctant to be named or to be kind of identified with having COVID. And I think there's also a sense in some situations that because there have been guidelines about what you should do to avoid getting COVID, that if you've got it, you failed somehow, you failed to follow those guidelines, you failed to maintain a distance, or you failed to wear your mask properly. So, I mean, that I think is something that we're trying to think about a bit more, and how you would deal with it. I mean, in Kenya, the Ministry of Health yesterday did say that they were seeing situations where doctors have been falsifying COVID certificates at time of death to show that the person didn't have COVID, so that the families could bury the people in the way that they wanted to. So, yeah, I mean, I think the stigma is really very much still there, and people are struggling with working out how to deal with it. So all ideas, I think, will be very welcome.
So thank you very much, Joe. Please, if you've got views on this and things which you can offer, do share. As we've found with the pandemic advancing, many of the issues we have to deal with are ones for which there are no simple answers. With Ebola, we had real challenges. Joe, you'll remember, Catherine's here with me as well. She'll remember, it's Catherine Deland, just how hard it was to connect with communities around the issue of how dead people are treated. And in the end, it does require, as I think most people would agree, you have to find a way to work with the local leaders, but it takes time. You can't just drop the issue into a community and expect people to come to terms with a different manner of death and death management than they normally would have, especially because proper management of the dead body is so important, both for the individual who's dead, for their soul, but also for what the spirits associated with that dead person will then do to the community if they're not properly managed. And so thank you, Joe. We'll keep talking with you about that. Thanks for sending. The other thing I tell people, Joe, a lot is that you've been tuning in to a lot of the local radio programs where you listen to the phone-ins and you listen to the kind of dialogue that goes on between people from all over Somalia as they ring in to the program. I don't know whether the program's broadcast from in Somalia or in Kenya, but it does sound as though that's a very important thing, and presumably that's continuing. People are continuing to use radio as a way for talking about their fears and concerns. Is that right, Joe?
Yeah, that is right. And there's sort of, it was related to Iran at one point, but there's some radio services that do those call-in radios conversations. And actually, the concern about COVID had really dipped over the past 2 months. And right now it seems to be increasing again. And it's a lot to do with questions about how you identify a person that has got COVID and about how you don't accidentally misclassify someone with, for example, asthma as having COVID.
Yeah.
But there's still, I think there's still a lot of concern about how you're meant to treat people. And there's a sense that unless there is a state-of-the-art ICU, then there's no point in going to the hospital because it doesn't have the equipment you'll need. So even with that, there's a lot of communication issues that we need to sort of go past before people will seek treatment if they need to.
Thank you. I'd now like to go to Rojan Dahal in Kathmandu. Rojan, first of all, I appreciate you may not want to switch on your video because you may not have good internet. While you're just turning on, Rojan, before you speak, I'd really like to acknowledge that my brother William is on the call. William has been very kindly supporting us in 4SD during the last few months, and it's a delight, William, that you're here. Thank you for being with us. Rojan, namaste. Would you like to just briefly say your comment now? Well, that smooth transfer didn't occur because I think Rojan is not here. Okay, thank you. Well, let's see. He also was saying, what are the chances of the disease spreading from dead people infected with COVID? Personally, I think this is quite important. We had this issue with Ebola as well, and I would want to talk to colleagues. Rojanji, thank you for joining again. If you can hear me, perhaps you might like to make your comment now. Rojan, if you'd like to unmute, let's see whether it works. Rojanji, okay, thank you. We'll come back to you later to see if it works. So Georgina is asking, Georgina, you're there, I can see you. Your video may be on. Georgina, if you'd like to unmute, if you'd like to come in now, and then I'll come to Rojan after you. Georgina, would you like to unmute and make your comment, please? Okay, Georgina, yeah, Rojanji, perhaps you can, Georgina says she can't unmute, so let's just see if there's anything we can do from our side that will help. Okay, we'll keep going on, Georgina. Rojan, would you like to speak now? Okay. All right, Georgina, we'll see if yours works in due course. Let's go to, I'll just ask Twee.
Hello?
Hello, Georgina. Come. Yeah,
yes.
Great. Where are you?
Winnipeg, Manitoba, Canada.
How do you do? Would you like
Grateful.
to make your comment?
What do you comment on the kids going back to school in a few weeks? Everybody's talking about it and concerned.
Yeah. So I'm going to do this, drawing on what, yeah.
And cases are going up to March levels.
Yes. So my colleague, Mike Ryan, who's head of the Health Emergencies Programme in the WHO, is clear to me. He says, you've got to look at what's happening in a school within the context of what's happening in the community. And obviously, if in a community, numbers of people with COVID are rising, then that should influence your decisions about the school. Don't treat the school as separate from the community within which it functions. Number two, we've got a lot of evidence that suggests that very small children, even if they get COVID, don't very often get sick. The numbers who get ill are quite small. Secondly, there is no good evidence that children who've got COVID pass it on to adults in their homes or in other settings. But there are still anxieties that it is not fully understood. So what I have to say to everybody, which is what I learned from Mike, which is we cannot give any cast iron assurances about schools, but we're working on a series of hypotheses. The last thing I need to say is that older kids in schools or in camps or in other settings are able to get COVID and transmit it. They don't get very sick, but they do. So I'm talking here about adolescents. And that means that we have to treat older age schools, high schools, and universities as though they are like anywhere else where people can get COVID and can transmit it. If I had school-age children, I would be extremely concerned that every effort be made in the school to practice all the elements of reducing risk of transmission, physical distancing, mask wearing, hygiene, hands, but also cough etiquette. And I would absolutely insist that any child who has symptoms of disease stay away from school. I would also be prepared to ask schools temporarily to close if there is a spike of disease in the vicinity where the school is. I noticed that in Kenya, according to Joe, the school year has been cancelled and children may not return until January. And that the Minister of Health has said they're not even sure it's going to be possible in January. Well, I must say that I am seeing lots of different positions being taken about schools, and I personally quite understand it. My own daughter-in-law has a small child who goes to a nursery, and I have been involved in multiple conversations with her and my son, her husband, about whether or not it's okay for their child to be going to school. I'm also in a long conversation with a mother in Ireland who's got a severely disabled teenage child and a younger child who's ready to go back to school. And she's super concerned about whether or not that child should be going to school with the possibility that infection could be brought home and given to her disabled teenager. So I have no blanket guidance on schools. Georgina, I will keep focusing on this, and I'm very happy to come back to the issue of schools in every open online briefing I do. And I'm quite happy also if you wish to have a direct correspondence with me about this, because I appreciate it's so difficult. Now, Tracy in Vancouver. Tracy is most concerned about an aspect of this. Tracy, if you are able to unmute, perhaps you could say what it is on your mind. Over to you. Over to you. Welcome.
Hi. Thank you, David. I'm really concerned for the children who have been sick and are recovering. They had it very mildly, but the effects, the long-term effects on their health going forward, and the exponential effects as they grow up well, of course, we haven't been able to research much of that. And we won't know much about that for many years, but it is of great concern because, you know, they're human beings just like the adults who have the long tail COVID. So I'm very concerned about that. And also about the educational and social effects on children. They do talk about it, but sometimes can't articulate how they're feeling. And it's a great concern. In British Columbia, the teachers in our schools are very concerned, and many of them would like to delay the return to school. until there is a clear understanding of the protocols. Some children did go back to school in June. Many were stayed home, but they did have schools open in some areas, and protocols seem to be working reasonably well, although some teachers did become sick and those classrooms were closed down. So yeah, it's of great concern to me for the children.
Yeah. So I've been connecting with colleagues in the UN Children's Fund and also UN Education Organization, UNESCO. And there is most definitely a program of research underway, both on the impact of the lack of access to school that's taken place in many parts of the world during the last few months, and secondly, on the possible impact of mild COVID on school-aged children. I totally agree with you that we have to keep an absolutely open mind about this. I'd in fact like to identify several phases of life where I still believe more information is needed. COVID infection in pregnancy, early pregnancy, late pregnancy. COVID infection in early childhood, COVID infection in adolescence, and then of course, adult and older persons. So thank you, Tracy, for bringing that up. Sometimes I really need a little prod like this to put the issue right at the top of mind, and I will follow up and take it as seriously as I can together with my colleagues. I'd like to go to Mary Mananda, who works within the World Health Organization, but she works in the Healthy Aging Program. Mary, would you like to give us your comment, but perhaps you could also give your suggested answer to it. If you could do it in about a minute, that'd be great. Mary.
Thanks, David. So the Decade of Healthy Aging has just been endorsed by the member states of the World Health Organization, of the World Health Assembly. So this is going to be 10 years of concerted, coordinated, collaborative action by all stakeholders to improve the lives of people in the second half of life now, but also then everybody who will step into that in the future, to enable them to have the lives that they have reason to value, to be and do the things they have reason to value. And COVID has revealed, as you say, a great level of disparities and inequities around the conditions for older people, particularly in care settings. So one of the issues is how we bring together the health care system and the social care system, and make a much more holistic approach to looking after people in the second half of life. I'm very interested in anybody's thoughts on how civil society, other stakeholders can contribute and join with us to really implement the priority action areas of the decade. We are just about to release a paper that brings together COVID and the priority action areas of the decade, because the decade proposal was drafted by member states and UN and civil society before COVID hit us. So we need to make those links very clear for member states and stakeholders to be able to act and see the relevance and the connectedness of the opportunity we have with the decade to really build back better for older people now and generations to come. So that's really all I want to say about that, but thanks for that. And for continuing to champion older people as well in your work. Thanks.
So Mary, thank you. It's me. What a lot we've had to learn quickly about the indignities and inequities that are experienced by older people all over the world, particularly those who are in residential care, and just how terrible the situation is, not just for the people themselves, but also for those who are employed to care for them. And Mary, it's been great to work with you as this decade that focuses on the issues faced by older people has been launched right at the time that COVID has been revealing so many challenges all over the world. It's not in any single country or group of countries, it's global. I'm just thinking of Purvi, who's on the call, who's from looking at India, that you're seeing these issues, I know, in South Asia as well. So thank you for that. I'd just like to welcome DJ Forza, who's Director of Partnerships for the World YMCA. DJ, would you like to have the last word? Over to you.
What an honor. Well, thank you so much, David. It's very educational hearing from you today. I've read some of your briefings, but hearing them is a completely different matter. It really strikes the sense of urgency, but also in some cases optimism. So thank you so much. For those of you I haven't met, you may not know the YMCA. You may think of it, we say in the US, as swim and gym, or in the UK, you might think of it as youth hostels or emergency housing. But we're really a youth empowerment organization. We're the world's largest and oldest youth organization. We reach 65 million people in 120 countries, roughly 45 million young people. For us, young people is anybody sort of 17 to 30, depending on your cultural context. And we're adapting. We're going through tough times like everybody else is, and we're looking to the leadership at the WHO. We've had a very lovely video message of support from Dr. Tedros, encouraging young people to, to step up and to work with the authorities in their local region, to practice good hygiene, all those things. And so I guess the message I'll leave you all with is, if we're going to get through this together, we need to partner. And what the YMCA can bring is, of course, the potential to mobilize our movement, leadership through our Secretary General, who I jokingly call the Pope of the YMCA, and who's the spiritual leader of the YMCA, and really to help young people get through this. And to the point of Mary, the intergenerational piece, YMCA certainly is a beacon for seniors as well. So intergenerational is very important to us. So please connect with me on LinkedIn, and if I can help you in any way, we stand ready. Thank you so much.
Thank you very much indeed, very much. So this was the beginning of our second series. As I say, we'll bring in more guests, but I will also continue to do the starter update. Today was longer because I felt I had a little bit more to cover. The recording of this will be on YouTube, accessible through the 4ST website. So you go to www.4st.info. You'll find the recording. You'll also find Chris Shipton's illustration, and we will highlight that illustration as we close. Lastly, Twee says, please do sign up to our newsletter via the website. Then that helps you to get reminder emails before the next session. And we've shifted the second session each week just by one day. It's on Friday mornings at 8:30 a.m. Please don't hesitate to tell others and say to everybody, we're super happy if people only come on for 5 minutes or 10 minutes or the beginning or the end. That's absolutely fine by us. We just want this to be something that you can access, bring yourself up to date. And I wish I could just invite everybody to give a great big clap to Chris. Chris, you are an absolute master. And so we're getting the claps coming up. Chris, if you want to say anything, you're welcome to as we close out. And then I hand over to Twee in case there's any sign-off stuff. But with this, I'd really like to thank you all for sparing the time to join and for staying connected, not only to us in 4SD, but to each other, because we really do need to hold together and work together as one big team as we help society to stay ahead of this virus and be ready for any new surges that might come. Thank you again.
Oh, hi David, this is Chris here. I just want to say thank you for having me back, and I'm looking forward to hearing more across the upcoming season. So it's very informative and interesting.
Thank you. Thank you very much indeed. It's lovely, this one. I'm looking at it, I'm into it. Okay, bye-bye everybody.